Hey everyone, and welcome back to the Deep Dive. You know we love to tackle the topics you're most interested in, and today we're diving into one that you specifically requested.
That's right. We're looking at a study you sent over about making a really crucial procedure safer for patients' intubation.
And given your expertise in respiratory therapy, this is definitely right up your alley. So before we jump into the specifics, maybe we can just step back for a second.
Sure.
For those who maybe aren't as familiar with intubation,
Right.
can you give us like a quick overview of what it is and why it's so important?
Absolutely. So imagine someone's in the ER and they're really struggling to breathe. Maybe it's a severe asthma attack, pneumonia, heart failure,
Right, a lot of different things.
a lot of different things. Exactly.
Yeah.
And intubation is basically putting a tube down their airway to help them breathe, often with a ventilator.
Okay.
It's a really common life-saving procedure, but it's not without its risks.
And that's really what this study is all about, right? Trying to minimize those risks, especially one in particular.
Yeah, exactly. You're talking about hypoxemia, right?
Yeah. Hypoxemia. Yeah.
Hmm.
That sounds a little scary.
Yeah, it can be.
Mm.
It's basically when the blood oxygen level drops too low, and that can be really dangerous, especially during intubation.
Okay, so pretty high stakes then.
Definitely. It can lead to cardiac arrest, even death.
Got it. So this research is looking at how to prevent that from happening during intubation.
Exactly.
And they're specifically comparing two different approaches, right?
That's right. The traditional approach with an oxygen mask and then something called non-invasive ventilation, or NIV.
Okay, so most people have probably seen an oxygen mask, but NIV might be a little less familiar.
Yeah, it's basically a way to deliver oxygen or air under pressure using a mask or helmet.
And the idea is that this might be better at prepping patients for intubation than just a regular oxygen mask.
That's what this research suggests.
Yeah, interesting. So what makes you say that? What did they actually find?
Well, the standard approach with the oxygen mask is helpful, don't get me wrong,
Right.
but it has limitations.
Hmm.
Even under perfect conditions, it can't deliver 100% oxygen. And plus, if the mask doesn't seal properly, which happens more often than you think,
Right, I can imagine.
oxygen levels can drop sometimes to like 50%.
Wow, that's a big drop.
Yeah, it's significant.
So even a small improvement in preoxygenation technique could make a big difference then.
It's huge, especially when you consider the number of intubations happening every year.
Yeah, how many are we talking?
Over 1.5 million just in the U.S.
Wow. So a small improvement could have a ripple effect on a lot of patients.
Absolutely. That's why this research is so important.
So tell me more about this study then. What makes it so special?
Well, first of all, it's the largest randomized controlled trial ever done on this topic. Over 1,300 patients across 24 U.S. sites.
Wow, that's impressive.
Yeah, and what's really interesting is that it was designed to mirror real-world practice.
Okay, so not just a perfectly controlled lab setting, but more like what you'd see in a busy ER or ICU.
Exactly. Clinicians were able to make practical decisions, like choosing specific NIV settings or the type of oxygen mask to use.
So it's more applicable to what you might actually face in a real hospital.
Exactly.
But I imagine they had to have some criteria for who could be in the study, right?
Oh, yeah, absolutely.
The-
They wanted to make sure the results were relevant for folks like you working in respiratory therapy.
Right, of course.
So they focused specifically on adults needing emergency intubation, either in the ER or the ICU.
Okay, so those are the folks who are most likely to benefit from this research.
Exactly. And they excluded certain patients like those already on ventilators or needing immediate intubation.
Okay, makes sense. So they were really targeting the group where this research would be most valuable.
Exactly. And there were a few other exclusions too, like patients who might not be good candidates for NIV,
That's who?
someone who's extremely agitated or has facial trauma, for example.
Okay, those make sense.
Yeah.
You know, one concern I've heard about NIV is the risk of aspiration. Did the study address that at all?
They did, and this is where it gets interesting. They actually found no increase in aspiration risk with NIV compared to the oxygen mask.
Oh, wow, really?
Yep. Only 0.9% in the NIV group had aspiration events versus 1.4% in the oxygen mask group.
That's pretty reassuring.
Yeah, it addresses a big concern that a lot of people have.
So they're saying NIV is just as safe as the standard oxygen mask in terms of aspiration risk.
At least according to this study, yeah.
Okay, so that's one hurdle cleared. But the big question is, did NIV actually deliver? Did it reduce hypoxemia?
Here's where it gets really exciting.
Yeah.
The results were pretty remarkable. Hypoxemia, which we defined as oxygen saturation below 85%, occurred in only 9.1% of patients in the NIV group,
Okay.
compared to 18.5% in the oxygen mask group.
Wow. That's almost half.
It is. It's a
Yeah.
9.4 percentage point reduction in absolute risk.
That's huge. So using NIV for preoxygenation really does seem to make a big difference.
It does. And when you think about what that means in terms of real lives,
Right.
the number needed to treat, or NNT, was just 11.
Okay, I'm not familiar with that term.
So basically, it means for every 11 patients using NIV for preoxygenation, one instance of hypoxemia is prevented, potentially saving a life or preventing serious complications.
So it's not just the statistical difference. It's a real impact on patient safety,
Exactly. And remember those other risks we talked about during intubation?
like cardiac arrest.
Yeah, the study looked at those too. There was only one case of cardiac arrest in the entire NIV group compared to 7 in the oxygen mask group.
While those numbers are small, that difference is still pretty significant.
Absolutely. Even one prevented case of cardiac arrest highlights how impactful NIV could be.
Okay, so this is all sounding really positive, but does this mean all hospitals should switch to NIV now?
This trial definitely provides strong evidence to make NIV the standard whenever possible.
Right.
But there are practical considerations.
Of course.
Hospitals need the right equipment, and staff need training on how to use NIV effectively.
Makes sense. Not every hospital has the same resources.
Exactly. And while preventing complications with NIV could save money in the long run,
Right.
the initial investment in equipment and training is something hospitals have to think about.
It's always a balancing act, isn't it?
It is.
Now, this study was done in the U.S., so how confident are we that these findings would apply to other healthcare systems around the world? Especially given your experience working in all sorts of different settings.
That's a great question. While all the sites were in the U.S., the techniques they used are pretty standard worldwide.
So the benefits of NIV should apply regardless of where you are.
Physiologically, yes.
Yeah.
But you brought up a good point earlier about different healthcare systems.
Yeah, I was thinking that even something like intubation might be practiced a little differently in other countries.
Absolutely. Different countries might have variations in their standard practices.
Right.
For example, in Japan, they're really cautious about preventing aspiration.
Okay.
So their approach to using NIV might be a bit different.
Interesting. So even though the physiology is the same, the way we apply these techniques might need to be adapted.
Exactly.
Yeah.
It highlights the importance of considering context when we're looking at research findings.
Right. Just because something works in one setting doesn't mean it'll automatically work in another.
Exactly.
So while the physiological benefits of NIV probably hold true globally, how it's implemented might need to be tailored to different healthcare systems.
Exactly. And that's where your expertise and the expertise of other respiratory therapists around the world comes in. Understanding the nuances of your local healthcare system and your patient population is key to integrating new findings like these into practice.
Okay, so we've established this study has a lot to offer, but no study is perfect, right? What are some of the limitations we should keep in mind?
You're right, every study has limitations.
Yeah.
One of the biggest here is that it was unblinded, meaning both the patients and the doctors knew who was getting what treatment.
Right, and that can sometimes introduce bias.
Exactly. It's kind of unavoidable when you're dealing with a procedure like this, but it's something to keep in mind.
Okay, good point. What about the data itself? Are there any issues with that?
Actually, they did a really thorough job with the data. Their sample size calculation was based on solid research, and they found an even larger effect than they initially expected.
Oh, wow.
Yeah, and their statistical analysis was solid. They even adjusted for potential clustering by site.
Okay.
Plus, they only had 3% missing data for the primary outcome, which is really good for a trial this size.
That is impressive.
And they didn't just ignore that missing data. They used appropriate methods to handle it.
So we can be pretty confident in the results then.
Yeah, I'd say so.
Okay, so strong evidence, well-designed, study good data. Well, what's the bottom line here? What should our listeners take away from all this?
Well, if I had to sum it up in 3 points,
Yeah.
NIV for preoxygenation significantly reduces the risk of hypoxemia.
Okay.
It's safe to use,
Okay.
and it's something that most hospitals can implement without too much trouble.
Nice and concise. I like it. Anything else specifically for our listeners, given their background in respiratory therapy?
Yeah, absolutely. This research really highlights how important it is to stay up to date with the latest evidence
Right.
and to advocate for best practices in your workplace. Implementing NIV for preoxygenation, where appropriate, could really improve the care you provide to your patients.
That's a great point. So even though this is just one study, it has the potential to make a real difference. Okay, so I'm curious, given how promising this research is, what does it mean for the future? Are there certain patient groups who might benefit even more from using NIV?
Definitely, I think patients who already have low blood oxygen levels
Okay.
or who have limited breathing capacity would stand to gain the most. The trial also suggested that obese patients might see even greater benefits.
Which makes sense when you consider the challenges they often face with breathing.
Exactly.
Yeah.
But on the flip side, there are also some patients where we'd want to be more cautious about using NIV.
Okay, like who?
For instance, patients who are severely agitated, have significant GI bleeding, or need to be intubated immediately.
Right, so those are situations where the risks might outweigh the benefits.
Exactly. It always comes down to weighing those risks and benefits for each individual patient.
Great point. Well, we've covered a lot of ground here. Before we dive into the next part of this deep dive, I want to leave you with something to think about.
Okay.
Given everything we've learned about NIV for pre-oxygenation, its potential benefits, and the challenges of implementing it across different systems, what do you think the future of emergency medicine and critical care will look like? How might this research influence the way we care for patients around the world?
That's a great question to ponder. We've seen how a relatively simple intervention can have a significant impact on patient outcomes. And as we continue to gather more evidence and refine our techniques, we can expect even more positive changes in the future.
I'm definitely excited to see what the future holds for this field. All right, let's pick this back up in just a moment.
So, before the break, you were asking about the future.
Right, the big picture stuff.
Yeah, and thinking about the potential impact of this research, it really got me thinking about what emergency medicine and critical care could look like.
Well, as someone who works with these patients every day, I'm all ears. What kind of changes are we talking about?
Well, just imagine a world where hypoxemia during intubation is way less common.
Okay.
That can mean fewer complications, shorter hospital stays, maybe even lower healthcare costs.
That's a pretty optimistic vision.
It is. And of course, we have to be realistic. It's not a magic bullet.
Right.
We still need the right equipment training and careful patient selection to make NIV work effectively.
So it's not just going to fix everything overnight.
Right. It's not a one-size-fits-all solution.
We can't just flip a switch and say, okay, everyone use NIV now.
Exactly. There are always going to be situations where it's not the best option for a particular patient.
So it's about expanding our toolkit, giving us more options, and making informed decisions.
Precisely. And, research is always evolving. What we know today might change as we learn more.
That's a good point. So even though this PREOXXI trial seems pretty definitive, there's always more to learn.
Absolutely. And that's what's so exciting about this field.
So what questions has this research sparked for you? What are you thinking about now?
Well, it makes me wonder about personalized preoxygenation strategies.
Yeah.
You know,
Okay.
could we tailor our approach based on individual patient characteristics, like their weight, their health conditions, even their genetics?
That's fascinating. It's like personalized medicine, but for intubation.
Exactly. I
Eh?
think we're just scratching the surface of what's possible.
So this study is really just the beginning.
I think so. It's opened up a whole new way of thinking about preoxygenation and maybe even the entire process of intubation.
Okay, now I'm getting really excited about the future of medicine. But let's bring it back down to earth for a second.
Sure.
We've talked a lot about the big picture, but how does this research actually translate to your work as a respiratory therapist?
That's a great point.
Mm.
It's easy to get lost in the abstract, but ultimately this research is about helping real people.
Absolutely.
Yeah.
So how would you explain the significance of this to a fellow respiratory therapist?
I'd say this study shows how important our role is in safe and effective intubation. NIV preoxygenation gives us a new tool to prevent hypoxemia and make things better for our patients.
So it's about being informed, advocating for best practices, and always looking for ways to improve.
Exactly. And, we talked about some concerns with NIV, but I think it's worth repeating that this study found no increased risk of aspiration.
That's huge,
Yeah.
especially for those of us who work with these patients every day.
It is. Aspirations is a big worry. And it's understandable that people would be hesitant about anything that could increase that risk.
Right.
But this large, well-designed study found no such increase with NIV.
So that should put a lot of minds at ease.
I hope so.
Yeah.
It really highlights how research can challenge our assumptions and change how we practice.
Sometimes we need to reevaluate what we've always done in light of new evidence.
Absolutely.
Hmm.
Now, you mentioned earlier that the researchers had specific criteria for who could be in the study.
Right.
Can you remind us what those were?
Oh, yeah. So they were specifically looking at adults who needed emergency intubation, either in the ER or the ICU. They excluded patients who were already on ventilators or those who needed intubation right away.
Right. Those wouldn't have been appropriate for this study.
Exactly. And they also excluded patients who had conditions that might make NIV risky.
So they were really trying to narrow it down to the group where they could get the clearest results.
Exactly. And one of the things that impressed me was how they let clinicians make real-world decisions within the study,
Oh, yeah. They weren't forced to follow a rigid set of rules.
which makes the findings a lot more relevant to everyday practice.
Absolutely. They recognize that real-world clinical practice involves making judgment calls based on individual patients.
It sounds like this struck a good balance between being scientifically rigorous and being practical.
I agree. They weren't just trying to produce data. They wanted to produce evidence that could be used to actually improve patient care.
And speaking of data, you mentioned earlier that they had very little missing data.
Right, which is always a good thing.
Why is that so important?
Missing data can really mess things up in research. It can introduce bias, skew. The results make it hard to draw conclusions.
I see.
But this trial had a very low rate of missing data, only 3% for the primary outcome.
Okay.
So we can be more confident in the findings.
And they didn't just ignore that missing data, right?
No, they used appropriate methods to account for it.
So they were thorough from start to finish.
Exactly. Attention to detail is so important in research.
Well, I have to say, the more we talk about this study, the more impressed I am. It sounds like they really did a great job.
They did. It's a really well-done study with important implications for patient care.
Now, besides the potential benefits for patients, could this research have other implications? For example, could it affect healthcare costs?
That's a great question, and it's something that researchers are looking into.
Okay.
If NIV does lead to fewer complications and shorter hospital stays, as the evidence suggests, then it could definitely save money.
That would be a big incentive for hospitals to adopt NIV.
Absolutely.
Yeah.
And it shows that good patient care and responsible resource management can go together.
Okay, now I want to play devil's advocate for a minute. Are there any potential downsides or unintended consequences we should be thinking about?
You're right. It's always important to look at things from all angles.
Mm.
I think one concern is the potential for over-reliance on NIV.
Okay, how so?
Just because it's effective in the study doesn't mean it's the right choice for every patient in every situation.
So there's a risk of it becoming a one-size-fits-all solution.
Yeah, exactly. And that's something we always want to avoid in medicine.
It's about finding the right balance between using evidence-based practices and tailoring care to each individual.
Precisely. We don't want to cling to old ways of doing things, but we also don't want to jump onto every new trend without thinking critically.
So a healthy dose of skepticism is always a good thing.
Absolutely.
Right.
Now, you mentioned earlier that this trial was unblinded,
Right.
and that can be a limitation. Can you explain why?
Sure. So unblinded means that both the patients and the doctors knew who was getting what treatment. And that can sometimes lead to bias.
Could you give an example?
Imagine a doctor who knows a patient is getting NIV. They might subconsciously pay closer attention to their oxygen levels or intervene sooner if there's a problem.
Okay, I see.
And that could make NIV look better than it really is.
Right, because the difference might not actually be due to the NIV itself.
Exactly. So even though they tried to control for bias, it's something to keep in mind.
Absolutely. And that's why it's so important to have multiple studies using different methods to confirm the findings.
So we're not just relying on one piece of evidence.
Exactly. The more evidence we have, the more confident we can be.
Okay, so we've talked about the potential impact of this research on clinical practice, but how do you think it might inspire future research? What new questions does it raise?
That's a great question.
Yeah.
I think this study opens up a lot of new avenues for research.
Like what?
Well, for example, we could explore how to personalize preoxygenation strategies even further.
Right. Tailoring the approach to each individual patient? Exactly.
Wow.
Or we could investigate the long-term effects of NIV preoxygenation.
So there's still a lot to learn.
Definitely. This study is a starting point, not an ending point.
Okay, so this research has implications for both practice and research.
Absolutely. It's a great example of how those two things go hand in hand.
Well, before we wrap up this section, I want to leave our listeners with one final thought.
Okay.
We've talked about how this study could change clinical practice, but how might it also impact healthcare policy? How could this research be used to advocate for better care for patients?
That's a really important question to consider. This study provides strong evidence to support the use of NIV for preoxygenation,
Right.
and that evidence could be used to push for changes in guidelines and protocols.
So it's not just about individual clinicians making changes, it's about systemic change.
Exactly. And that can sometimes be a slow process.
Of course.
But research like this can help to move things in the right direction.
It gives us the ammunition we need to advocate for our patients. Absolutely.
Mhm.
All right, let's take a quick break and then come back for our final thoughts.
All right, we're back for our final thoughts on this deep dive into the PREOXI trial, and I have to say I've learned a lot.
Me too. It's been a really fascinating discussion.
We've covered everything from the nuts and bolts of how NIV works to these big picture questions about the future of critical care.
Yeah, it's amazing how one research study has sparked so many different ideas.
It really is. Now, before we wrap up, I want to circle back to this idea of generalizability. We talked about how this study was done in the US,
Right.
but how much can we really extrapolate these findings to other countries, other healthcare systems, especially given your experience working all over the world?
That's the million-dollar question, isn't it?
Hmm.
And it's something the researchers were aware of, too. The techniques they use for both NIV and the standard oxygen mask are pretty standard globally.
Yeah, they're not unique to the US.
Exactly. So the basic physiology should apply anywhere.
Right. The way the lungs respond to oxygen and pressure, that's universal.
Exactly. But as we've been saying throughout this deep dive, context matters.
Right. We can't just assume that what works in one place will automatically work everywhere else.
Exactly.
Mm.
There are so many other factors to consider.
Like what? Give me some examples.
Well, let's take Japan again. They have a very strong emphasis on preventing aspiration during medical procedures.
Okay.
So they might be much more cautious about using NIV compared to the
Maybe
U.S.
because of that cultural factor.
Right. Their protocols might be different. Their criteria for selecting patients might be different.
It's fascinating how these cultural and societal factors can shape medical practice.
It really is. And then there's the issue of resources.
Hmm.
NIV requires specialized equipment and training.
And not every hospital has the same budget.
Exactly.
Yeah.
So even if the evidence is strong for NIV, it might not be feasible to implement it everywhere.
Right. There are practical limitations.
Absolutely.
Yeah.
And even if you have the equipment, you need people who know how to use it properly and maintain it.
It's a multi-layered issue.
It is.
Hmm.
There's the science, the logistics, the cultural factors.
It's not as simple as saying, new research, great, everyone should do this now.
No, it's much more nuanced than that.
But even with all those complexities, this research is still incredibly valuable.
Oh, absolutely.
Ah.
It gives us a strong foundation to build on. It shows us what's possible.
And it pushes the field forward.
Exactly. Okay, so we've talked about the benefits, the challenges, the
Yeah.
generalizability. What about the study itself? Anything that really stood out to you about how they did the research?
Yeah, I was really impressed by how rigorous they were. The way they designed the study, the way they collected and analyzed the data.
It was very thorough,
Very meticulous. And they were upfront about the limitations of the study.
which is always a good sign.
It shows that they're being honest and transparent.
And that makes me trust their findings even more.
Absolutely. All right, so as we wrap up this deep dive, what's the one thing you want our listener to take away from all of this?
The main takeaway is that this study provides strong evidence that NIV is a safe and effective way to pre-oxygenate patients before intubation. It can significantly reduce the risk of hypoxemia, and that can have a real impact on patient outcomes.
And for our listeners specifically,
I'd say this study really highlights the importance of staying informed about the latest research and advocating for evidence-based practices.
right, using this knowledge to improve the care we provide.
Exactly.
This is one study, but it has the potential to make a real difference.
Absolutely. And I think it gives us hope for a future where intubation is a safer procedure for everyone.
I completely agree. It's exciting to see these kinds of advances happening in critical care.
It is. It shows what's possible when we combine rigorous research with compassionate patient care.
Well said. Well, that's a wrap on our deep dive into the PREOXI trial. Thanks for joining us, and we'll see you next time on the Deep Dive.